Hi, I am Dr. R. Satyaraja, Assistant Professor, Faculty of Physiotherapy, Dr. MGR Educational Research Institute, Chennai. Vertebral artery test is one of the tests which is done to check the vascular sufficiency of the vertebral artery. Vertebral artery is an artery which runs to the posterior part of the foramen, which is at the cervical spine. It starts from C6, C5, C4, C3 and C2, and both right and left of the vertebral artery join to form the basilar artery which supplies the posterior part of the brain. Vertebral artery test is a sensitive test and a pain provoking or a symptom provoking test. It has to be done very carefully, and it is done in this manner in the following process. The patient is made to come at the end of the couch or at the bed, and initially we start to do a mild extension. So neck is gone to the extension and is rotated to the one side, and is kept in this position with support passively for around 30 seconds. During this, we find about the symptoms of the vertebral basilar insufficiency. If the vertebral artery has an insufficiency, will elicit symptoms in case of nystagmus, loss of mild sensation over the scalp and the facial side, nausea, vomiting, etc. After 30 seconds is over, the test is sent to the neutral position and a normal position. The test indicates positive side to the opposite side. So when you're doing to the right side, when you have symptoms, it means the indication of vertebral insufficiency towards your left side. If you're doing it for the left side, it indicates to the right side. The positive signs in the vertebral artery test indicates there is a reduction in size of the lumen of the vertebral artery during the movement. So when we say that vertebral artery is being insufficiency or compromised, there is a reduction in blood supply to the brain or the posterior part of the hindbrain. Thus, this holds as an important test for the cervical spine assessment and during joint of your cervical spine manipulation mobilization, which typically involves cervical spine from C1 to C4 by typically of the rotation of 45 degrees of your head.